or swelling. Both arms are symmetrical. So I'm just gonna feel with the back of my hand the temperature of your skin. Okay, so skin is warm, dry. Does this feel the same on both sides?
Yes.
Okay, perfect. And sensation is intact bilaterally, upper extremities. So I'm gonna pinch your fingers and check for your capillary refill. So that looks good. Capillary refill is about 2 seconds bilaterally. I'm gonna feel for your pulses. We've got good radial pulses bilaterally, about 2+. Okay, so I'm gonna look at your head and we'll kind of start from there. So can you take your hair out for me? Thank you. All right, so I'm looking at her hair. Hair is even, distributed evenly. I don't see any dandruff or lice or anything extra in there. Her hair's not chemically treated right now. So I'm just gonna feel your scalp. Any pain when I'm doing this?
No.
Okay, so no pain on palpation. I don't feel any lumps or bumps. Okay, great. While I'm up here, can you press against my hand? That side, and then front, and then back. Okay, so strength is intact there too. So then I'm gonna move on, looking at the face. So her face is symmetrical, eyes are the same. Their eyes are symmetrical. I'm gonna check your sinuses. So do you have any pain where I'm pressing here?
No.
Okay, any pain here?
No.
Okay, so no pain on frontal or maxillary sinuses, so that's good. So does this feel the same on both sides here?
Yes.
Okay, can you squeeze your eyes together really tight and then lift your eyebrows up really wide? Okay, and then smile for me, and then frown. Okay, perfect. And then can you stick your tongue out and move it side to side? Great. Okay, so facial nerve is intact. So I'm gonna start with the eyes. So I'm looking at the eyes. I don't see any periorbital edema. I don't see any ptosis. They're symmetrical with each other bilaterally. So I'm gonna pull down on your eyelids or your eyes to see the inside of your lids here. So conjunctiva is pink and moist. So I'm gonna press very gently. Is there any pain right here?
No.
Okay, so lacrimal glands are non-tender on palpation. There's no discharge. I'm gonna use my pen light. I'm gonna shine a light, so you just look straight ahead. So, all right, so cornea is clear. Cornea is clear. Iris is blue. Sclera is white, no injections. Do you have any allergies or anything like that?
No.
Okay, perfect. So I'm gonna shine a light and look in your eyes and make sure that your pupils are reacting at the same time, okay? So just look straight at, you can look at the tip of my nose. All right, looks good. Okay, so that one contracted and then this one contracted as well. So I'm gonna do this side. Perfect. All right. Perfect. So pupils are perla. So what I have you do is follow the tip of my pen light just with your eyes. Okay, so keep your head nice and still. Up, down, over, and then. All right, so the oculomotor nerve is intact for the 6 fields of gaze, so great job.
Thank you.
Yeah. So then I'm gonna go ahead and move down the face. So gonna look at your nose. Nose is midline with the face. I don't see any lesions or redness or acne or anything like that. Can you press down on one side and go? Okay, perfect. Now other side. Great. Okay, so nasal airway is patent, bilateral nares. So I'm also going to, I'll have you just tip your head up for me, and I'm gonna look up. If I had a tongue depressor, I would be pushing kind of out that side a little bit to kind of help me out to see here? Okay, so just little hairs in the nose and some clear mucus. So nose is straight, so I'm just gonna kind of feel down your nose. Is there any pain where I'm touching?
No.
On the sides here?
No.
Perfect. Okay. So now your ears, you mind kind of putting your hair behind your ears? Great. So I'm gonna look at her ears. Ears look good, skin isn't red, there's no edema. So I'm gonna feel your ears. Any pain where I'm pressing?
No.
Okay, so no pain on palpation bilaterally for the ears. I'm gonna go ahead and look inside the ears. Ears are clean, just a little bit of yellow cerumen. Thank you. Okay, ears are clean bilaterally. Skin is intact. So I'm gonna test your hearing. I'm gonna lean over this way. I'll have you hold this ear closed. I'm gonna say a number and I want you to repeat it for me, okay? So go ahead and hold that side closed. Thank you.
5.
Okay, great. Now to the other side.
7.
Great. So hearing is intact bilaterally. So we're gonna move down and look at your mouth and your throat. So on the outside of the mouth, your lips are pink and not dry. Have you opened for me? Can you stick your tongue out and say ah? Okay, uvula rises on phonation. Hard palate looks good. Pink and moist. Inside of the mouth looks good. There's no redness. No tonsils. Tongue looks good. And then teeth are there's no missing teeth. Gums are tight in line with your teeth. Do you have any issues with your teeth? Any pain? Nothing? Oh, and I would have done this before I moved on to the face. I'm gonna check your temporal artery. So I'm just gonna feel on the sides of your face here. Okay, so temporal artery is about like 1+ bilaterally. And then can you open and close? Any pain while you're doing that?
No.
Okay, so TMJ, there's no clicks, it's smooth. And then we're gonna move on. So I'm gonna look at your neck. Let me just reference really quick. Yeah, okay, that looks good. Okay, so I'm gonna look at your neck. Neck looks good, skin is intact, no redness, I don't see any visible pulsations. I'm gonna check the vessels in your neck, make sure that they are like moving appropriately with gravity. So what I'll do is I'm going to take off my gloves and then hand hygiene. So I'll have you lay down for me, and then we're gonna look for JVD. So I can see her carotid artery. It is pulsating here, which is appropriate, and I'm gonna check the other side. Okay, looks good. And then I'll help you sit up. Okay, and then JVD should be absent at this point when she's sitting up, and it is. Perfect. All right. So I'm also gonna feel, just while we're in this area, for some lymph nodes, okay? So tell me if you feel any pain where I'm touching you, okay?
No pain.
No pain? Any pain down here?
No.
No? Okay, I'm gonna do cervical lymph nodes. Any pain over here?
No.
None? Perfect. All right. So JVD, trachea is midline. I'm just gonna, tell me if this hurts. I'm just gonna move your trachea a little bit. Trachea is midline and movable. And there's no deviation to one side. So I'm going to listen. And what I'm gonna have you do is, let me figure this out. I'm also going to swab to clean off my stethoscope. Clean. So what I'm gonna have you do is hold your breath when I tell you to, and I'm gonna listen for any bruise in your neck, okay? Okay. And normally I would have a stethoscope that had a bell on it. I realize that this one isn't appropriate for this part of the exam, but we're going to pretend. Okay, so go ahead and hold your breath. Okay, and now on this side, go ahead and hold your breath. Okay, so I don't hear any whooshing, I don't hear any bruise, so that's good. So we'll move on. I think what I'm gonna do next is look at your, the back of your back and listen to some lung sounds, okay?
Okay.
So I think I'll go on this side. So looking at the skin on her back, I'm just gonna lift your shirt up a little bit here. Checking for any irregular breathing patterns and symmetry. She's breathing regularly. Sorry, my hands are kind of cold. I'll do this on the outside. So I'm gonna feel, and breaths are even with equal lung expansion. Great. So I'm just gonna feel down your back. Let me know if there's any pain where I'm touching you.
No pain.
No pain. Okay, down here at all in your ribs?
No.
Nothing? Okay. So I'm just going to listen to your lungs. Every time you feel me move my stethoscope, I want you to take a deep breath. If you feel like you're going to pass out, just raise your hand and we'll take a break, okay?
Okay.
Go mid-axillary. Okay, how you doing?
Good.
Okay, so breath sounds are equal bilaterally in all lobes, posterior chest. Okay, so I'll have you sit in front here, and I'll pull up my stool. So now I'm gonna look at your, I'm gonna listen to the lungs, or your lungs in the anterior part of your chest, and listen to your heart as well. So I'm looking at the skin on the anterior chest, and it is intact. It's warm. There's no pain in the lymph node area. Is there any pain where I'm touching you down here?
No.
Any pain down here, around
No.
here, nothing like that? Okay. So I'm gonna listen to your lungs in the front here. So just same as last time, just take a breath every time you feel my stethoscope move. All right. Okay, great. So lung sounds anteriorly on the chest are all clear, both lobes bilaterally. I'm gonna listen to your heart as well while we're here. Okay, so I've got S1, S2, and I'm also going to check your pulse here with my stethoscope for a minute. pulse about 69 beats per minute.
Okay.
That's good.
And her height and weight matches her stature. Okay, so we'll get started with your head assessment. Okay, tell me if you feel any pain or tenderness upon my palpation. All right, upon inspection, no infestations, lumps, lesions, or bruises. Okay. Palpate your forehead. All right, any tenderness?
No.
All right, perfect. So I'm going to do a quick eye exam on you. Okay, so I just ask that you look at my nose while I shine the light, okay? All right. Pupils are round and reactive to the light. Also, would you follow the thin light to your nose? All right, and accommodation is equal bilaterally. So would you mind closing your eyes for me really fast, okay? Any tenderness?
No.
All right, no abnormalities noted upon palpation of the eyelids. I will also look under your eyelids as well. All right, it is noted that conjunctiva is pink and the sclera is white. Okay, so I will go ahead and look in your ears really quick. All right, no redness, no drainage upon inspection. No redness, no drainage. Perfect. Okay, so I'm just going to go ahead and inspect your outer earlobes. Tell me if you feel any pain. No?
No.
All right, perfect. You go down, palpate the rest of your face. All right, can you open your jaw for me? All right, any clicking?
No.
All right, no TMJ click noted. Would you mind closing your eyes for me and tilting your head back? Perfect. All right, nose is free of redness and drainage. Would you mind closing your eyes again? And would you close one nostril for me? And tell me if when you smell any scent, okay?
Yes.
Okay. Other nose? Or nostril?
Yes.
All right, perfect. So, there are no occlusions blocking the airway passages, as well as her scent is intact. So, I'm just going to palpate the outer nose for you. Any tenderness, anything?
No.
No? Okay. Can go down. All right. Would you mind closing your eyes for me once again? Can you tell me which side you hear the snapping out of?
On the left.
All right.
On the right.
All right, perfect. Now I'm just gonna assess your lips. They are pink, symmetrical, and they are moist. Okay, all normal and good. So would you mind opening your mouth for me? Okay, and say ah. All right, uvula rises and falls midline. Tongue is midline as well. Mucosa is pink. No dental carriers, as well as no broken teeth. Perfect. All right. So we're going to go down to the throat. All right. Upon inspection, there does not seem to be any enlarged lymph nodes. Her trachea appears to be midline. Would you mind lifting up your head and down, left and right? Okay, no JVD was noted upon inspection. So I'm going to go ahead and palpate your throat, okay? Tell me if you feel any pain or tenderness. Anything?
No.
All right. Lymph nodes were not enlarged upon palpation. I'm going to go ahead and feel for your carotids, okay? Perfect. Carotid artery was 2+ bilaterally. So I'm going to go ahead and listen for bruits as well. All right. All right, perfect. No bruits were noted upon auscultation. Okay, so we're going to move down to your chest portion. So upon inspection, there does not seem to be any labored breathing, as well as no accessory organs being used for breathing. Would you mind taking a breath in and out for me? Okay. Same goes for the posterior. There does not seem to be any labored breathing or accessory muscles being used to breathe. Okay, so I'm going to go ahead and do some breath sounds. I just ask that you move towards the window. All right, thank you. All right, breathe in, out, in, out, in, out, in, out, in, out, in, out. We'll do the same thing for the back, so I ask that you turn this way from. All right. In, out, in, out, in, out, in, out, in, out, in, out. Perfect. So there was no adventitious breath sounds heard upon auscultation. So I will also go ahead and listen to your heart sounds. I just ask that you turn this way again. All right. And you can breathe normally for this part. And would you mind lifting your left breast? Thank you. All right, and I'm just going to do the same thing for heart murmurs. Would you mind? Thank you. All right, perfect. Upon auscultation, no heart murmurs were noted, as well as S1 and S2 were steady, as well as no extra heart sounds. Okay, so gonna go ahead and do your arms. So, all right, no scars, no bruising. Okay. Skin tone is even. I'm going to check your cap refill. All right, 2 to 3 seconds. Same with this arm. No scars, no bruising, no lesions, no lumps. Tattoo is noted. All right, cap refill is 2 to 3 seconds on this arm as well. Check your radial pulse really fast. All right. All right, radial pulse is 2+ on each arm. I'm going to check for skin turgor. All right, good skin turgor. Good skin turgor. Okay, now will you do like this with your fingers for me? All right. No clubbing noted upon assessment. Okay, would you mind rolling back for me? All right, so I'm going to check for your apical pulse. Okay, to find that, I'm locating the notch, going down to the angle of Louis, going over to the 2nd intercostal space, going down to the 5th intercostal space, mid-clavicular, and it's right there. Okay, so I'm going to cover you up. Lift up your shirt. Okay, I'm going to listen to about a minute. All right, and start. Alright, stop. Okay. Apical pulse was 82 and steady. Alright, so upon inspection of the abdomen, umbilicus is midline, no distension noted, as well as no hernias, no lumps, no lesions, no bruising. Okay, so I'm going to listen to your bowel sounds really quick. All right, great. Present bowel sounds. I'm just going to go ahead and palpate. Tell me if you feel any tenderness. Now, can you tell me when was the last time you had a bowel movement?
This morning.
All right, perfect. And are you having any issues voiding at all?
No.
All right, and are you feeling any pain in the perineal area?
No.
All right, perfect. Okay. All right. I'm going to go ahead and do a quick assessment on your legs. Okay. Upon inspection, there is no swelling. Do you have any pain in your legs at all?
No.
All right, legs are warm to the touch. No signs of edema, varicose veins. Okay. All right, temperature of the feet is warm as well. Any pain in your feet?
No.
All right, I'm going to check your pedal pulse. All right. All right, pedal pulse is 2+ bilaterally. I'm going to check skin tone on your feet. All right, perfect. I'm going to check capillary refill. All right, 2 to 3 seconds. And 2 to 3 seconds. Okay, perfect. All right, so tomorrow I'm going to have you sit up for me for this last portion. Okay.